Have you ever felt unsure after a doctor's visit, like the test you just took might have caused more stress than relief? Many people over 70 feel this way, especially when medical exams lead to confusion instead of clarity. At this stage of life, your body responds differently, and not every test brings more peace of mind. Sometimes, what's meant to help actually hurts. And most seniors don't even realize it's happening. Imagine walking into a clinic for a routine checkup, only to leave with fear, prescriptions, or even a procedure you didn't truly need. This isn't a rare story, it's becoming common. Certain medical tests that once made sense can become harmful after 70. And the scary part? Even well-meaning doctors may not warn you in time. But there is a better way. New research, and bold voices in the medical community, are sounding the alarm. Some health screenings may do more harm than good for seniors. As the body ages, test results can be misleading. They lead to unnecessary treatments, overdiagnosis, and even hospital stays. But if you know which tests to avoid, you can protect your health and your peace. In today's video, I'll show you 5 checkups that doctors say seniors over 70 should be cautious about, or skip entirely. You'll understand what to avoid, what to question, and most importantly, how to stay safe while staying informed. PSA Test, prostate-specific antigen. The PSA test is often recommended for men to detect prostate cancer early. But after age 70, it becomes one of the most controversial checkups, and for good reason. PSA levels naturally rise with age, even without cancer. This can lead to false alarms, anxiety, and painful biopsies that weren't needed. Worse, many prostate cancers found after 70 grow so slowly they'll never cause symptoms or shorten your life. But once detected, they often trigger aggressive treatments like surgery or radiation. These procedures come with serious risks: urinary incontinence, erectile dysfunction, and emotional stress. All for a cancer that might never have harmed you. Leading experts, including the U.S. Preventive Services Task Force, now advise against routine PSA testing in older men. It's not about ignoring cancer, it's about understanding your risk. Overdiagnosis is a real danger. And at 70 plus, the focus should shift to quality of life, not unnecessary interventions. So how do you apply this in your daily health choices? Talk to your doctor clearly and ask, is this test really necessary for me at my age? Personalized care matters more than ever now. And avoiding this test without symptoms might actually protect your long-term vitality. Take Gerald, a 74-year-old from Phoenix. His PSA test came back slightly elevated. It led to months of appointments, a biopsy, and fear, until they realized it was a benign enlargement. He says if he had known the risks, he would have waited and asked more questions. That's the power of informed choice. The PSA test isn't always wrong, but after 70, it can do more harm than good. Trust your body, ask the right questions, and remember, prevention doesn't mean panic. Colonoscopy. Colonoscopy is often promoted as a life-saving test for colon cancer, and for many adults in their 50s or 60s, it truly is. But after age 70, or especially 75, it may bring more risk than reward. The procedure involves sedation, bowel prep, and the potential for complications that become more dangerous with age: bleeding, perforation of the colon, and adverse reactions to anesthesia increase significantly in older adults. And here's what most people don't realize. The benefit of detecting new cancers drops after 70, especially if your past screenings were normal. For many seniors, continuing these tests adds stress, not safety. Medical authorities like the American Cancer Society now suggest stopping routine colonoscopies after 75 if prior tests were clear. That's because colon cancer tends to grow slowly, and catching it late in life rarely improves outcomes. Instead, the focus should shift to symptoms, not automatic screenings. So what's the smarter approach? If you have no digestive symptoms and had normal results before, it may be time to pause the testing. For those who still need screening, less invasive options like stool-based tests may be safer and more practical. It's not about skipping care. It's about adapting to your stage of life. Take Margaret from Ohio, age 78. Her last colonoscopy at 72 was clear, but her doctor insisted on repeating it. The prep made her severely dehydrated, and she ended up in the ER with heart palpitations. Her daughter later learned that test wasn't even medically necessary anymore. Don't let habit or fear lead your health decisions. At 70 plus, it's okay to say no to tests that no longer serve you. Your time, comfort, and energy are valuable, and colonoscopies aren't always worth the cost. Routine EKGs, electrocardiograms. An EKG might sound like a harmless heart check, but for seniors over 70, doing it without symptoms can open the door to unnecessary worry. Many older adults have harmless electrical changes in the heart simply due to age. These show up on EKGs and often get flagged as abnormal, even when there's no real danger. The result? More tests, more appointments, and sometimes invasive procedures like cardiac catheterizations. And yet, in people without chest pain or heart disease symptoms, EKGs rarely offer real benefits. Instead, they often create fear or lead to treatments that might not be needed or safe. Experts now agree. Routine EKGs in asymptomatic seniors can cause more confusion than clarity. The American College of Physicians advises against them unless there's a strong reason. At your age, clarity matters more than curiosity. And your heart doesn't need to be watched unless it's giving you clear signals. So when should you consider skipping it? If you're not experiencing chest discomfort, shortness of breath, or irregular heartbeat, it may be best to avoid. Let your symptoms, not habit, guide your care. And save your energy for the things that actually improve your quality of life. Just ask Henry, 76, from Denver. He went in for a routine check and had an EKG just because it was on the list. That led to weeks of cardiology visits, only to find out it was a benign age-related change. He missed a vacation he'd planned for months, all for a test he didn't need. This is your reminder. Tests without symptoms often create more questions than answers. Your peace of mind matters, and sometimes, not doing a test is the healthiest decision you can make. Bone density scan, DEXA. After 70, many doctors still recommend bone density scans to check for osteoporosis. While that might seem smart, the test can sometimes create more problems than it prevents. DEXA scans measure bone thickness, but they don't always reflect your true fracture risk after a certain age. The issue is this. Slightly low results often lead to powerful medications like bisphosphonates. These drugs can cause serious side effects in older adults, including jaw decay, stomach pain, and even rare thigh bone fractures, all to treat numbers that may never cause harm in your lifetime. Experts are now saying it's time to rethink this scan for seniors. If you've never broken a bone and stay active, a DEXA test might not change anything about your care. Instead, focusing on strength, balance, and nutrition may offer better protection than any number on a chart. So how do you apply this in real life? Ask your doctor, will this test actually change my treatment plan? If the answer is no, it may not be worth the worry. Gentle exercise, sunlight, and leafy greens often do more good than a scan, and they come without the side effects. Diane, age 74 from Austin, had a DEXA scan just because it was due. It showed mild osteopenia. Her doctor immediately prescribed medication. A few months in, she developed bone aches and quit. She now says she wishes she'd asked more questions first. The scan itself isn't bad, but blindly treating the results can be. At 70 plus, you deserve care that protects your strength, not just your score. Full body scans. Without symptoms. Full body scans are heavily marketed as early detection tools, promising to catch hidden diseases before they appear. But for seniors over 70, these scans often do the opposite. They spark fear, false alarms, and unnecessary treatments. Without specific symptoms, the results can mislead both patients and doctors. These high-tech scans frequently detect small, incidental findings that are harmless. But once seen, they usually lead to more tests, sometimes even surgery. This chain reaction is known as a diagnostic spiral, and once it begins, it's hard to stop. Many seniors end up treating problems that never needed fixing. The radiation exposure from certain scans, especially CTs, also builds up over time. At this stage of life, the long-term risks may outweigh any potential benefits. Organizations like the American College of Radiology advise against full-body scanning in people without clear symptoms or medical reasons. Here's the warning most seniors never hear. These scans are often sold directly to consumers, not recommended by doctors. They're advertised as peace of mind, but can create the opposite. And once fear sets in, it's easy to agree to more tests, more medications, and more stress. Robert, 75, from Seattle, saw an ad for a total body scan and booked it out of curiosity. The scan found a tiny lung nodule. That discovery led to 4 follow-ups, 1 biopsy, and weeks of anxiety, until they confirmed it was harmless scar tissue. He now says, "I paid to be scared." This is the danger. Chasing problems that don't exist can quietly rob you of time, energy, and calm. At 70 plus, clarity and comfort are worth more than a scan. If you feel fine, don't let fear drive your decisions, especially when no symptoms are present. Annual physicals without personalization. For decades, annual physicals have been treated as a health ritual. Book it, check all the boxes, and feel reassured. But after age 70, the one-size-fits-all checkup can actually miss what matters most. These generic exams often focus on outdated routines instead of what your body truly needs now. Blood pressure, cholesterol, weight. Those are important, but not always urgent. What's often ignored are things like sleep quality, joint flexibility, mental focus, or fall risk. These are the real indicators of vitality at this stage, and they rarely show up on a lab test. The danger lies in overtesting. Seniors go through panels of blood work, urine analysis, X-rays, and more, without symptoms or context. Minor abnormalities, which are common with age, become red flags, and that starts a cycle of more tests, appointments, and worry that could have been avoided. The smarter path is personalization. A meaningful checkup at 70 plus should be based on how you feel, not just what a form says. Are you walking steadily, sleeping well, feeling sharp? These are the questions that matter, and often tell more than numbers on a chart ever could. Sandra, 79, from San Diego, stopped doing her annual checkups after years of repeated tests and no real answers. Instead, she meets her doctor twice a year to review sleep, digestion, and energy. She says it's the first time her care actually feels tailored to her. Here's the truth. Your health at 70 plus deserves more than checklists. It needs attention to your real life, how you move, eat, sleep, and feel. A routine checkup isn't bad, but only when it's designed around you. After 70, your health journey becomes more about clarity than quantity. Not every test is helpful, and not every scan brings peace. The truth is, the best care often means saying no to unnecessary stress, and yes to what truly supports your vitality. You deserve to feel empowered, not overwhelmed. Your time is precious, your body is wise, and your experience matters. Let your care reflect that. With the right information, you can protect both your health and your calm. That's real freedom after 70. If this video brought you clarity, give it a like. Share it with someone who needs this truth. And let us know in the comments. Which test surprised you the most? Your voice helps others, and together we grow stronger.